from the campus of the University of Nebraska at Omaha. Consider This, a program of issues and information behind today's news.
So at this point, I think we have to believe this is respiratory. Maybe fomites, too.
What's that, fomites?
It refers to transmission from surfaces. The average person touches their face 2,000 or 3,000 times a day.
2,000 or 3,000 times a day?
3 to 5 times every waking minute. In between, we're touching doorknobs, water fountains, elevator buttons, and each other. Those things become fomites. What we need to determine, for every person who gets sick, how many other people are they likely to infect? So, for seasonal flu, that's usually about 1. Smallpox, on the other hand, it's over 3. Polio spread at a rate between 4 and 6. Now, we call that number the R naught. R stands for the reproductive rate of the virus. How fast it multiplies depends on a variety of factors. The incubation period, how long a person is contagious. Sometimes people can be contagious without even having symptoms. And we need to know how big the population of people susceptible to the virus might be.
So far, that appears to be everyone with hands, a mouth, and a nose.
Once we know the R naught, we'll be able to get a handle on the scale of the epidemic.
Hi everyone, I'm Kathy Wyatt. Welcome to this week's edition of Consider This. Our topic, hygiene and contagious diseases. Here to tell us more about it is Sharon Metcalf. Sharon is an assistant professor in the Department of Epidemiology and director of the Center for Biosecurity, Biopreparedness, and Emerging Infectious Diseases in the College of Public Health at UNMC. Thank you so much for being here and welcome.
Thank you for having me.
We're going to start with that opening clip from the movie Contagion, which not surprisingly is a pretty popular rental right now. The question is, did Steven Soderbergh get it right?
I'm smiling because I think it's a great movie, and they consulted with CDC throughout the entire process of making the movie. So I actually use it in my graduate classes with students who are learning about infectious diseases. So that's the good news. I'm smiling too because that particular scene was probably one of the most controversial scenes in the entire movie because our public health departments, and I think that scene is from Minneapolis or Minnesota State Health Department, but our public health professionals would absolutely know what a fomite is, and they would absolutely know what an R naught is. So that's interesting. But I still think from an educational standpoint, it was a great movie.
Okay, so what is a contagious disease, Sharon?
So we could use the movie as an example. So anything that's transmitted to people that causes disease, in other words. So we worry more, obviously, about something that's transmitted person to person, because then it's going to spread much faster than something that would be like a foodborne illness, where you would have to eat the food before you actually became ill with the illness. So that's the difference, in that we can propagate that disease if we can transmit it well between persons.
Okay, so then infectious disease.
So we use the terms, some people use those terms interchangeably, but contagious and what we would call communicable are exactly what she said on that clip. So she talked about the communicability or the contagiousness being related to, if one person is ill, how many other people do they on average infect? So she talked about flu, she talked about smallpox. What we know today, even about coronavirus, is that it's about 2.5. So that's an average, right? So every person who's sick is infecting another 2.5 people. So that's what we would call contagious or communicability. Infectious would be more related to the number of particles that it would take for us to actually become infected. So for influenza, for example, it takes 1,000 particles for me to inhale, on average, to become infected. Now for Ebola, it only takes 1. So that's what infectiousness refers to, is in terms of the number of particles. We don't know how many particles it takes of coronavirus to actually become infected. So that's one of the many unknowns about this disease and this infection.
One of many diseases. We have a list that we want to put up for our viewers. And as we're putting that up, Sharon, a lot of diseases on this list.
Yep.
Tell us really what's most important to note.
Well, I guess what I would say from the list that you're showing is that the vast majority, and I don't have the exact number, but I would say it's somewhere around 95% of all the contagious diseases or infectious diseases that you have on this list are transmitted via what we would call contact transmission. And it's sort of self-explanatory. So it literally means that I have to come in physical contact with the organism on my skin, and then I have to rub my eyes, rub my nose, those kinds of things. I would say so that's 95. So another 3% are probably transmitted by what we would call droplet. That's where I cough, sneeze, laugh, and it goes out about 6 feet, the organism, then it falls to the floor. And very few, enough to count on the fingers of one hand, are what I would call airborne. And those are the ones where the particles actually stay suspended in the air around you and can stay suspended for quite a long time. So that's that from a transmission standpoint. Those are the three mechanisms, and the only three mechanisms by which an infectious disease is transmitted. But the vast majority is contact. So that's why that whole issue of hand washing is so important.
Well, and since it is what everybody is talking about right now, how do you explain COVID-19 to people? I mean, when you're just trying, if you're in the classroom, wherever you are, and somebody says, so what is that really?
Sure.
How do you respond to them?
So the term COVID-19 is actually referring to the disease itself, or the infection itself. The organism or the virus that's causing it is actually a SARS derivative. So it's SARS-CoV-2. So we have a classification of viruses called coronaviruses, right? And there are A's and B's. The A's, and about 4 of the A's, are what cause the common cold every day for you and I. The B's are the ones that have emerged in the last couple of decades that are causing more severe illness. So the first one was SARS in 2003. We all remember that, the worldwide outbreaks. Our neighbors to the north in Toronto had probably the biggest outbreak that was close to us. MERS came along in about 2012. That's the Middle Eastern respiratory syndrome. And then, of course, now we have the SARS-CoV-2, which is COVID-19 this year. And they cause more mortality, more severe illness than the common colds. But they are part of that same family.
So take us back and briefly explain how all of this started.
Sure. So this is probably one of my favorite things to talk about in terms of how quickly everybody reacted. And I honestly think, and I'll preface that, is that if this had happened maybe 20 years ago, as did happen with the SARS in 2003, our reaction was much slower then than it is today. So I think December 31st was the date that the Chinese equivalent of a public health, the health authorities were contacted about, I think at that time there were about 27 people with this mystery pneumonia, about 7 were critically ill. So that's at the point where they bring public health in and the health authorities, and they investigated it and found that the common source for all of those cases was this market. So think about that. That's December 31st. By about January 6th and 7th, it was increasing, and they were monitoring cases very slowly. But all of those cases had a direct link to that market. It wasn't until about January 13th that we now had cases arising that we knew were not affiliated with the market, but had actually been in contact with someone who had been to the market. So that's when we know that a disease is transmissible person to person. And that's when the alarm bells go off. So that's January 13th. By January 17th, 3 days later, our own CDC were making plans, that was a Friday, to head out on the Saturday to those 3 initial airports that were screened, LAX, JFK, and San Francisco, because those were the airports that were getting direct flights from Wuhan. So that speed, 3 days from the time that we really knew it was person to person, is really unprecedented. And I always applaud our global public health for really, and in particular our own CDC, for acting really, really quickly.
Okay, recap again. Transmission by. I mean, just recap for us, how is this thing transmitted?
So remember I described those three, contact, droplet, and airborne. So this one falls under predominantly droplet. Now that means it's sort of like the flu, where you really, it's somebody who's within a 3 to 6 foot radius of you who's really fair game, right? So if I sneeze or I cough or I laugh or I talk, all of those items produce virus that would go out about 3 to 6 feet before it falls to the floor. There is some suggestion, but not good evidence yet, that there might be a particular part of that might be aerosolized. So there might be some particles that do remain suspended, but we don't have good data on that. We know from SARS in 2003 that patients in hospitals that were undergoing procedures that generate aerosols, like nebulizer treatments, that kids get, or intubation, where they put tubes down your throat to give you mechanical ventilation, or bronchoscopies and things like that. They knew that those high-risk procedures actually were creating aerosols. So and the way they found that out is that healthcare workers who were wearing surgical masks were becoming ill. And as soon as they made healthcare workers put on what we call N95s, which are a much tighter fitting mask, then those healthcare workers stopped getting ill. So that was our clue in 2003. So the jury's still out on this one, whether or not there's a component that is aerosolized, but there might be.
Okay, and of course, one of the major ways people are following this is through the media. So I have to ask, how do you think, big picture, that the media is doing in its reporting of COVID-19?
So I'd love to know what the sociologists think. But from my perspective, I think two things actually. One, I think that if the basic messages are repeated enough times to people that it really becomes ingrained. There's a whole science between good messaging, I know that. And people start doing things that now become second nature. Washing your hands, not handshaking, not touching things that have been touched by multiple people, staying home if you're sick, those kinds of things. If people really begin to understand and grasp and believe in those things, then it's doing its job. The second thing that I think that's coming from our media coverage is that it's almost normalizing some of the things that aren't day-to-day normal for us. So for example, if students that have been watching this 24/7 news coverage are seeing that 20 other universities across the country are now shifting to online learning, that becomes something that they say, oh, well, so it's happening across the country, so maybe it's not all that scary or out of the norm or insurmountable. And so I think from that perspective, I think it's helping things.
Okay, so you mentioned hand washing. This seems so basic, but at the same turn, in light of something like this, never a bad idea to visit it. So we have several graphics that we're going to put up for our viewers. And as we're doing that, Sharon, I want to go back to those basics, starting with hand washing. When are we supposed to be remembering to do this? So we'll put those up, and if you could just walk us through, just as a gentle reminder, that would be great.
Absolutely. So obviously after using the toilet, after cleaning children who've used the toilet or changing a baby's diaper, touching garbage, playing outside, after touching an animal food or animal waste. And I think one of the things that we need to remember, and these are some of the things that we know have been talked about in the news, sneezing, coughing, blowing your nose, before, during, and after preparing food, before you're eating, before and after you're caring for the sick, and common sense would be before and after treating wounds. But essentially what I want people to feel like and remember is that if you're touching surfaces, and your video clip was a great example, she mentioned, people are touching doorknobs and light switches and tables all the time. And those are the things that if they're touched by multiple people, that you run the risk of, again, getting it on your hands and then inadvertently touching your eyes or nose or mouth. So that's the bigger issue.
Well, and as with the times that we should be doing it, there is actually a certain way you should wash your hands. And so we want to go through a couple of those graphics, and then we can go more in depth after that. But let's put those up, and our viewers can take a look at that. Yeah.
So running water is really important. So it doesn't have to be hot water, it doesn't have to be warm water, just as long as it's nice running water. Lathering that soap between your palms scrubbing all through your hands, the back of your hands, the front of your hands, between your fingers, cleaning under your nails. And I think the cincher is, and we've been teaching this in infection control for decades, is that, 15 to 20 seconds. So we teach kids to sing songs. We teach people to count. I mean, there's all kinds of little tricks to make sure that we're doing that. But if next time you wash your hands, count how long you're actually doing that friction and that scrubbing. That's a long time. So that's a huge sort of a teaching tool for people. So rinsing it thoroughly, taking a clean towel to dry your hands, and then using that towel to turn off the faucet or open the door. I don't know if you're seeing lately, a lot of places are installing those foot pieces on the bottom of doors so that you can actually open your feet with your foot. If not, then they're placing the trash containers right by that door. So I don't know, you've probably noticed a lot of people carry their towels to the door, open the door, and then throw it away.
Yes.
So I think that's becoming common practice, but it wasn't 20 years ago.
Yeah.
So I think we've come a long way.
Sharon, where do hand sanitizers fit into all of this?
Yeah, great question. Very effective, for sure. But the CDC's recommendation for hand hygiene really always, and has always said, that in the absence of visible soiling, hand sanitizers are a great tool. But we always fall back on basic hygiene, washing your hands with basic soap and water at the sink. It doesn't even have to be antibacterial soap. Regular soap is just fine.
Okay. Yeah. I want to change gears a little bit and talk about those most vulnerable populations. So we have our older adults, and then we have our kids. Now, the older adults may very well know what to do, but not always capable of being able to because of challenges that they may be having, either cognitively or otherwise. Little kids, I mean, we all know they're on to the next thing all the time, right? So what would your advice be from an awareness standpoint, especially for those senior living communities and those child care centers, especially in the midst of this COVID-19?
Sure. So you talked about vulnerable populations being the elderly and the young. That is different for different infectious diseases. And in this case, so if we were talking about seasonal influenza, that would exactly be the case, right? We're very much worried about the people that are elderly and the young people, and from two different reasons, right? Your immune system at both ends of your life cycle tend to be a bit compromised. But in this particular case with COVID-19, what the data are showing is that it really is people over a certain age, and you've seen 60, you've seen 70, that have underlying medical conditions, compromised immune systems, pulmonary issues, cardiovascular disease, those types of things. So that's the population that we need to protect. So if that means that they themselves have to take as much action as everyone else, that's fine. But it also means that we want to make sure that anybody coming into contact with that vulnerable population are doing the things that they need to be doing, washing their hands. If they're in any way worried that they've been exposed or think they might be ill, they need to maintain that distance or not be in the same room at all. So that's really what we're worried about, is just keeping that vulnerable population. And it's really important for public health to understand what part of the population is the target population for an infection. Because down the road, when we end up getting vaccine for this coronavirus, we are going to not have 3 million doses overnight. They're going to trickle out just like it did during the 2009 H1N1. So we're going to want to make sure that we get the most vulnerable population that vaccine as soon as we can, along with healthcare workers and people that are putting themselves in harm's way every day.
Yeah.
So that's why it's really important to understand.
Well, the tough question, and one that you hear circulating, is if people aren't aware that this is what they're carrying, right? How do they know then, right? I mean, that's kind of a catch-22. It's like you want to be conscientious and you want to do the right thing, and you could enter a situation where you are feeling okay, and then later find out. What would your advice be to those folks?
So we don't know enough, unfortunately, yet about whether or not the virus is shed before people are symptomatic. So in most infectious diseases, because there are very few where you actually shed the virus and are contagious before you know you're ill yourself. Influenza is actually one of those. We know for certain that we shed the influenza virus before we are ill ourselves. There's no data to really confirm that with coronavirus right now, but because we don't know for sure, we have to be really careful about that. So there's no really good answer to say, short of saying, just stay away from the vulnerable population, period, right? So I think the message that we're really giving right now is that if you even suspect that you may have been near someone else who was sick, right? And we're doing a lot of contact tracing right now. Public health is doing exactly what public health does well, is they're contacting cases, they're contacting people who are contacts of cases and letting them know. So if public health has already told me that you were exposed to a case, then I know not to go near vulnerable populations. I mean, I know that right away. Now, there'll come a time where there's probably so much that public health won't be able to get ahead of this. But they're certainly going to try to stay ahead of it as long as we can. So otherwise, it's just maintaining that distance as well. And if it is droplet, and you have to interact with someone in the vulnerable population, we can certainly stay 6 feet away. We can stop hugging them, we can stop getting as close as we probably normally get because they're loved ones. Those are things that we can do just because we don't know.
Well, and one of the things that is coming out, especially in the senior living communities, are those lockdowns, and I'm sure you've been hearing about those. Is there anything that you're seeing, hearing, reading about that maybe you would ask them to think again on? It may be something that's not being done right from a procedural standpoint that you would maybe approach with caution.
Yeah, that's a tough one because I think there are all kinds of downsides to the whole lockdown issue or social distancing and what's going on in communities. Like what we saw in King County up in Washington State where they shut down the community basically. Unfortunately, the mental health repercussions of that are huge. But the mortality, we know, we have data from past pandemics. So I don't know if you've seen that slide that's been circulating the last few days that shows the curve of if we don't have any interventions in our communities, what it would look like versus the flatter curve. That's not a new graph. We were showing that decades ago. That was data that was from old pandemics that in as old as 100 years old, in the 1918 pandemic, where communities that were implementing these strategies, these non-pharmaceutical interventions, early and sustaining them for a long time, without a doubt fared much better than communities who didn't do it. Philadelphia held a parade right in the middle of the pandemic, and within days had 4,000 to 5,000 people dying from having been at that parade. So we know that they work. We know that we have to do it early, and we know we have to sustain it for a long time to reduce hospitalizations and to reduce mortality. So it's really a balancing act between the mental health repercussions of doing that and other downfalls. And the benefits, on our healthcare system, particularly.
For what you know at this point, is there anything that we collectively should be doing to help prevent this that maybe we aren't doing yet? Anything that comes to mind from where you're sitting, or maybe that should have been done sooner? I mean,
so that's a tough one too, because we don't have a lot of precedent, right? I do a lot of teaching of my graduate students based on historical outbreaks, and I use the story of Toronto a lot. One of the things that they did, they had to do a lot of outside of the box thinking. They had some interesting work to home quarantine for healthcare workers, because we need healthcare workers, right? So we know they're putting themselves in harm's way every day. We know that, but we're giving them all the protective equipment that's needed. But we want them to stay well. So they implemented some strategies for them to be a little more distant from their families, maybe not being in large gatherings. So they were doing that. I suspect we'll see that. They did a lot of screening of employees before they came in the buildings, and that's in a lot of our hospital plans for pandemic planning will be done. So a lot of these things are going to happen sooner than later. Okay,
single most important thing to remember about contagious diseases. If we take nothing else away from this program, what should we take?
If you're lumping them all together, I would say remember that 95% of them are transmitted via contact transmission, which means by your hands. So even though you're hearing 50 times a day to wash your hands, that is one of the single most best practices that anyone can adopt.
Wow. And we would know, another loaded question, I apologize, in just the few minutes that we have remaining, we're going to know we're in the clear when?
So two things. One is, as soon as we have a vaccine, it's over, right? We get the vaccine into the bodies of our community members. First and foremost, our vulnerable and our healthcare workers and some of our public service folks, right? Those are the ones that should be first in line. And then everybody else follows suit. We all remember in 2009 with H1N1, the target populations were those young kids and young adults. So we got them into the schools and the gymnasiums, and we got them vaccinated first. Once we've got the vaccine into everyone, it'll be over. Before then, however, as we're slowing down transmission, as public health does what public health does best, and that's making sure that we're identifying cases, investigating contacts, getting people quarantined and isolated. So quarantine is for people who are well, isolated is for the sick. We are essentially putting a barrier between that transmission and slowing down transmission. So that, back to that R naught at the beginning of your clip, if we can make that R naught less than 1, we're on the way out.
Wow. All right, we do have some websites, lots of really good information from you today, Sharon. We so appreciate it. If people are wanting to know more, these are some good sites. Check them out. The CDC, which has been referenced several times, cdc.gov, diseaseprevention.com, and of course, unmc.edu, which is in the middle of all of this. And we so appreciate everything that you guys are doing on the front lines there at UNMC. So keep up the great work, on behalf of everybody watching. Thanks for being here and sharing your time and expertise. We appreciate it. Best wishes moving forward with all of this.
Thank you. Thank you for having me.
You're welcome. And thanks to our students who are working so hard behind the scenes, and of course, to all of you for watching. As we close, a look at public art around Omaha as seen through the lens of Wyatt Waskowiak, a senior here at UNO. Thanks for watching. We'll see you next week.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at netnebraska.org/considerthis. If you'd like to share your comments about this program, call UNO Television at 402-554-2516 during regular business hours, or send an email to cwyatt@unomaha.edu.